Today, our special guest will be Leon, and Leon will share his perspective in getting into the mental health field. Enjoy. Hello, hello, hello.
Good morning.
Good morning. How are you?
I'm doing fine, thank you.
Wonderful, wonderful, wonderful. Thank you so much for your willingness to be interviewed today, and just to talk about your journey in the profession and how you got here, and just any changes that you have seen throughout the years. Mm-hmm. So how long have you been in the profession?
Well, I've been in the profession since like 1982. I got out of school, 1982, undergraduate degree in psychology. Mm-hmm. I was one of these people that I went to work kind of like right away. I went to work for Janet Waddell's Mental Health Center here in town in Rockford at the time. And my role was to basically follow chronically mentally ill adults, you know, on the streets. Mm-hmm. So I still know, to this day, I still know all the nooks and crannies of Rockford, Illinois, and where people and stuff hang out. So that's kind of like how I got my start. And then I went from there, and then I went to graduate school down at Royal University 10 years later. I worked there. And then I, got what I call a Master Social Work and Social Work Administration. And then I sat for 2 years at the Mental Health Center. And they wanted me to stay, but I didn't stay, so I was under supervision, and I got a LCSW to go out into independent practice. And then when I went into independent practice, I went with a group practice here in town in Rockford for a while, and then I went independently on my own. So that's kind of like how
got into it.
For the educational piece, yeah.
Wow. So you mentioned, you shared some letters, LCSW. What does that mean?
Okay. LCSW means a license in clinical social work, which that means is that you got to go to a school that's got a master's of social work degree, and then 2 years after that, you go and sit on another person with an LCSW, and then you get your LCSW, licensed clinical social worker, and then you have to take an exam, and then you can go practice independently.
Okay, wow, that sounds like a lot of work, that journey.
Well, that's a journey. It's about 3,000 hours post-graduate school. So anybody out there who wants to get into kind of like what I do and get your license and stuff, it's about 8 years of school.
Wow.
It's about 6 years of college getting your master's of social work. I got mine in administration, so I had to sit underneath the executive director of the agency that I was working for. And then I had to go after that, then I had to, till those 2 years are up, and then I had to sit and take the exam. And then had to pass the exam.
Wow. And so being in the field for so long, has things changed? Has things stayed the same?
I would like to think that they've changed. A lot of the laws, exterior laws have changed. For example, people of color laws have changed. People who have identify as certain, sexual orientations, that's changed. A lot of the labels have changed. They got new labels. They come up every 3 to 5 years. Research change. So yeah, things do change. Things don't stay the same. And it's like when you're working with people too. They change too with the times, as it goes along. As the laws change, as policy change, and those kinds of things.
Okay, wonderful. Is there a particular population that you're currently working with, that you have worked with?
Yes, I work with them all. I work with children. I work with adolescents. I work with young adults. But right now, I pretty much work with adults, anybody like 17, 18 and over to about 80 years old, as long as they can, talk and communicate and, share information and those kinds of things. We go over treatment plans and all that kind of stuff. But I do specialize, if you're trying to get to what I specialize in. I specialize in what is known as cognitive behavior therapy. And most people know that as CCBT, cognitive behavior therapy. I like to do that. And I'm constantly assessing how they think, how they perceive information, those kinds of things. And I'm constantly assessing people's level of motivation all the time.
This year's theme, because May is Mental Health Month, is More Good Days Together, right? What does that mean to you, more good days together?
Well, if you take to like today, for example, I like to stay in real time, and I use a phrase like the big picture. Well, the big picture for me is more good days together, is just having a great day. And this is something that you can't control to a certain extent. A certain extent of how you process information, how you deal with a situation that comes up. You can respond in a way that's a positive way. You don't have to respond in kind of like a negative, kind of way. And sometimes some of us need help to do that.
Okay.
And sometimes some of us need support to do that from like family, like friends and those kinds of things. But there's a number of people out there that don't have those supports. And then they call, they call people like myself, healthcare professionals and stuff.
Okay.
But just having a good day, making yourself have a good day, making the best of a situation that didn't turn out the way you wanted to turn out.
Wonderful. So being in the field for so long and the population that you serve and working with cognitive behavioral therapy, right? How do you regenerate yourself? How do you ensure that you continue to stay on the top of your game?
Yeah, and that's a good point. And I would encourage all social workers, psychiatrists, psychologists, mental health people, anybody that works with people, to take care of themselves away from their profession. What I do is I go to the YMCA. I belong to the YMCA. I'm a long-term member of the YMCA. I've been involved with them since like 1970. And actually my mother got me started in the YMCA when I was a little kid, like 3 years old. That's how I learned how to swim. And I learned how to swim there, and then I learned how to came up through Cub Scouts and Boy Scouts and those kinds of things. So she got us all in them activities that didn't cost a whole lot of money. And back in them days, it was like nil and none in between. So I go to the YMCA. I'm a big member of the YMCA. I also believe in God and Christ, so that church that I belong to. So when I read the Bible, those kinds of things, those are the kinds that really help me, stay grounded and stuff, because you need to really be able to take care of yourself. And I also got good friends. I have a best friend that I talk to at least once every 2 weeks. Actually, I got friends from high school, because they know you in this field. You get all kind of stuff. So you have to listen. There's a lot of listening. A lot of listening, a lot of processing. This kind of interview, this kind of setting is more casual, but when I'm working, it's like my ears are like, I got these Dumbo ears, and I have to stick to my profession and stuff like that, and you weed through stuff like that. So that's kind of like how I do it. And then I watch what I eat, that kind of stuff. But just balancing myself out and doing those things away from field. I do a lot of reading. Okay. There's some stuff on the internet you don't want to read, but you got to read it anyway, because your clients, they come in with this information, so you got to know a little bit of something. And plus, with the information changes every 3 to 5 years, you have to stay on top of that. So, definitely. So that's kind of like how I stay balanced. Another way I stay balanced too, I belong to associations. I belong to two that I constantly read information from. That's the National Association of Social Workers, NASW, and I also belong to the Cognitive Behavior Therapists, organization too, on a national level. As I go to, so I constantly get readings and those kinds of things and publications that I go through. Definitely. Yeah, so I set out some time to do some reading. Definitely. Yeah. So how are you able to ensure that you have family time? Yeah, family time is very important for me. Like today, after I'm done later today, I get out of the office, I'm gonna go visit my grandkids who live up in Janesville. I'll take care of that, but I budget it into my schedule. And the way I work it is, I'm retired now. I retired like 4 years ago. It'll be 5 years that I'll be doing independent practice coming up just by myself. So I limit what my hours are here privately. I do about 10 hours a week. So I budget that so I have time to spend with my family. Time not only spend with just my wife and my kids and my grandkids, but other people, too, like my friends and stuff. You have to balance those kinds of things out. Yeah. Wonderful. What advice would you give upcoming social workers, therapists, psychologists coming into the field? Wow. Well, first thing I would say is that, one, this is hard work. This is really, really hard work. I mean, I may look relaxed and those kinds of things, but it's really hard work working with other people. And when you see people, you got to see them as kind of like in the now. You got to see them in the present, and you don't know what they're going to bring in to see you. So you have to be prepared, and you have to study, and then you have to read, and you have to take care of yourself. It's a combination of things that make it work for the people that you see that you provide services to. And you want to be able to, I see it like this. I see it as a way of helping people help themselves. It's like I'm passing along something to, like planting seeds. You plant seeds, you plant a little bit of seeds, and then the man above kind of like waters and stuff like that. So you hand off what you've learned, and you pass it on to the next generation. So that's what I try to do, and that's what keeps me coming back. You know, and there's going to be people that are receptive of it, and there's going to be people that are not, but that's okay. You keep going on anyway.
Definitely, definitely. So when I say cherish your mental health, right?
Yeah.
Cherish your mental health.
Yes,
What does that mean?
For me, it means to just cherish every day, take care of yourself, take care of the people that are around you, and try to make it for a better day, you know, every day. And you can do that. That means being responsible. That means taking charge. That means being healthy. These are some things that you can kind of like plan yourself. You don't really leave it up to anybody else. And everybody else that you have around you are support systems. And there's a lot of good supports in this area to help me take care of myself.
Wonderful, wonderful. Any conversation around stigma for those that are not aware of mental health, not aware of anxiety or depression, or just changing their thought process?
Well, yeah, I mean, I think that the best thing you can do is just come and talk to somebody. That would be the first thing. And it doesn't really have to be a therapist. It don't have to be a psychiatrist. It don't have to be a psychologist. It can be just a friend. You got to start someplace. You start with a friend. It could be a group. It could be, you know, a pastor. Just start talking to somebody. Don't keep the stuff in you. Don't keep the depression in you, the anxiety in you. Even a trauma. I mean, trauma is a big deal. I see a lot of that. You don't have to keep that stuff in the inside of you because there's good people around that are willing to listen. And that's how you start. Yeah.
Okay, wonderful, wonderful. Is there anything else that that you would like to share today?
Well, yeah, I would. I would just say, you know, for next month, that's when the mental health month is next month?
Yep, it may, yep.
Okay. But just, if you haven't ever been to counseling before, a therapist before, a psychiatrist before, just start somewhere. Anything little that you can do to start talking to someone, that's going to help you out. You don't have to come and see me or anyone else. You can just start by pastor, start by just talking to a friend or a girlfriend or a boyfriend. Start that way. That's the easiest way to go. And you want to find somebody that's kind of like, that fits you, that you have a good fit with, you know, kind of thing. That takes work to do that, but you can do that.
Definitely,
Yeah.
definitely. Thank you so much, Mr. Black, for coming and sharing and just giving us some additional insight on who you are and how you were able to get into the profession and how you balance, right? That's so important, so important. Thank you so much.
Well, you're welcome for having me.
Yes. Thank you.
You're welcome.